And Austin was very happy, running around, physically active.
Where's Austin?
He was just like any normal 2-year-old. You don't have this thought that there's this big issue.
From 7 to age 13, many misdiagnoses. They thought he had muscular dystrophy. They thought he had just a host of different things.
We walked in and there was like 8 doctors in white coats, and I thought, this is really weird, like what is going on? And then they said, your son has MPS.
You're scared to death, for him, and you just don't know what to expect.
We had never heard of mucolipidosis. We had never heard of even the word storage disease.
Okay, so what do we do? Tell me where I need to go to get the treatment to fix it. This was my biggest thing. Let's fix this. Everyone's silent in the room. And when they say, well, there's no treatment and there's nothing we can do, in fact, the prognosis is terminal. You kind of go numb and you sort of, sorry, you don't really want to believe it.
Your body is full of different enzymes. These are the hammers, the screwdrivers, the saws. These are the pieces of tools that help you build your body and break it down. And so depending on which ones you're missing, you have a different effect on the body.
Mucopolysaccharidosis and mucolipidosis are progressive diseases. A child is unable to remove the waste from their cells. Those cells begin to implode, swell up, create storage throughout the entire body.
The heart gets bigger and their features get coarse, their lips get bigger, their airway gets bigger and coarse and tight. Their lungs get full of this stuff and it's almost like they have asthma. Their joints get restricted and they can't straighten them. And then in the brain this happens as well, and it causes progressive intellectual disability.
We don't really know what is it about the mutation or the amount of storage material that determines why someone has neurologic disease and some other patients don't.
They're born normally. They'll gain normal milestones, so your child will learn to talk. Your child will learn to walk. And then progressively lose those things.
He knew a lot of his letters, the colors.
Animal sounds. Physically was able to kick a soccer ball forever, in the backyard.
And a Sanfilippo child, a lot of the cells that end up being damaged are in the brain.
When he was, about 7.5 years old, he became almost completely nonverbal. Austin's maximum kind of mental development capped out at about 2.5 years old. Now today he would score about at the 1.5-year-old level, even though he's 9.5 years old.
The parents are watching their child deteriorate in front of their eyes and are powerless most of the time to do anything about it.
Spencer did walk. He would run, played baseball, just like a lot of the other kids. Since it's a progressive disease, all of that has just, his condition has gotten worse. And he's been in a wheelchair since 3rd grade, and he's a freshman in high school now. He's got a lot of joint issues and joint pain. His hips are permanently dislocated. He's got a heart condition. He's got some problems with his lungs. Most of it is all physical. We've been very lucky and blessed that he hasn't been affected developmentally.
Which I'm about to use. I finished first!
Spencer and his sister are very close. Her role, I think she figured it out herself, has been his protector.
Sometimes when I wake up at night when my leg hurts, sometimes my mom and dad don't wake up right away, so she'll scream and tell them that Spencer needs help. That's your ball! Go, go, go!
All the way, all the way!
There you go, all the way!
Help her.
You can do it, you got it! I like to root for my sister when she plays her soccer or stuff that she is interested in, because she can probably go really far.
Like, even though he has that pain every day, he has a smile on his face. He's always happy, encouraging me, and I try to encourage him.
There's no treatment or cure for his condition, unlike some of the disorders. It's just keeping the kids comfortable and dealing with whatever orthopedic or health issues that come up.
Dr. Neufeld had been working on the MPS disorders for 30 years. Now we were at that threshold, at that moment, when you could do something about this disease. It turned out to be difficult, but starting in 1991, we were able to get to the first patient in 1997.
When the enzyme is administered intravenously, it gets into cells. It allows the cells to function more normally.
Today we have treatments for MPS 1, MPS 2, MPS 6.
Enzyme replacement therapy has to be given for life.
It's not a cure, but it's able to put some halting to the disease's progression.
Can you say that it's a life-saving treatment? Yes, definitely.
They both take their IV pumps back to their bedroom and they go to sleep. And when the treatment's over, they want to be unhooked so they can go to Disneyland or whatever else they have planned for that day.
It's kind of weird because the grim reality of it is that most people afflicted with this don't live past, their early 20s. So I'm now 24, and you've essentially been given a second chance, a new lease on life.
Currently, we don't have a treatment for MPS 4A, 4B, for MPS 7, for MPS 3, and for mucolipidosis.
We're specifically testing for MPS 4 or Morchio 4A at this point. If the data looks good and supports approval sometime late 2013, there would be a therapy available.
The reality is that there are still some symptoms that don't respond well to enzyme, and in particular, we still have not yet treated the brain. It is harder to treat the brain than it is to treat physical disease.
What the blood-brain barrier is designed to do is to keep things out, to protect the brain cells. But what it also does is it keeps mechanisms out that you want to cross the blood-brain barrier can't get in.
We're working on a way to develop an enzyme treatment using the cerebrospinal fluid as a delivery system.
That's a major issue that researchers struggle with right now.
As far as looking at pictures when they were younger, it's difficult. Russell used to smile and laugh, and he used to run. He lost his mobility about when he was 9. She's starting to now lose her mobility as well. She's not jumping on a trampoline anymore, and we had to put Russell in a wheelchair, and then about less than a year later, we had to put him with a feeding tube because he quit being able to use the muscles, and she's starting to do that now. Not your fingers. There we go. Everything just atrophies. It's devastating.
It is absolutely heartbreaking to know that the natural order of things is not going to be followed. That is, children bury their parents. Parents don't bury their children. And in most of these MPS families, it is the latter, as it was in my family.
As far as treatment goes for MPS 3, it's a race against time. Hoping, believing, and praying for it every day.
The mission of the National MPS Society is to find treatment and cures for the MPS and ML disorders, and also to support families.
By having national meetings and also supporting local meetings, it allows people not to feel so isolated.
For the first time, you're sitting with a parent that knows exactly what you're going through.
People ask us how we do it. And there's, we've got our faith, we've got our family, we've got the MPS Society.
They were really instrumental in advocacy with the FDA and the federal government, getting approval for certain drugs, getting federal funding for research.
Basic science is critical because if we don't have new discoveries, we have nothing to translate We have nothing new to bring to the clinic, and so that too is funded by the National MPS Society.
The National MPS Society has raised millions of dollars over the years through walk-run programs, family events. They've gotten extremely creative, and we've been able to take research from the lab and move it into clinical trials. But we still need to do more. Every child deserves to be saved.
It's pretty fun. Yo-yoing is a pretty good. You can do it sitting down. This one is called the Eiffel Tower.
Spencer has a very positive outlook on life, despite the challenges and the pain that goes with that.
I pray almost every day that they'll find a cure for his disease.
I really want to get a good GPA in high school so I can get to a good college and have a good future. I look forward to when they maybe find a cure, and but that might not be for maybe many years, but I'll try not to let that stop me and stop me from achieving my goals.
Rare diseases have this tremendous disadvantage that very few people have them, and there's very little public interest in them. And so you're always fighting an uphill battle.
It's not like treating cancer or diabetes where there's millions and millions of people.
But with these rare diseases, we have a chance to do something profound and meaningful to transform lives. We could be doing more with the science we already have.
We won't stop fundraising until there's a cure. My daughter is going to be faced with these choices. She's going to potentially have a child with MPS, and I want her to know that even if she has a child born with this gene, that's okay, because we have a cure for it, honey, and don't worry.